So David, you're here today after I did ankle surgery on your left ankle, right?
Yes.
And you came to me because I guess I operated on your son-in-law, right?
Yes.
So you came to me as a second opinion because you were sent to go to Tampa, Florida to have an ankle fusion surgery, right?
That's
Is
correct.
that what I remember?
The other doctors I went to had said that they wanted me to do ankle replacement or fusion.
Oh, fusion, right.
And then my son-in-law told me about you, and I came down here and it has subsided my pain tremendously.
Right, because when you came to me, you said you couldn't play with your grandchildren, your ankle was giving you so much pain, and basically we decided to, instead of fusing you or doing an ankle replacement surgery, which are both surgeries that are extremely involved and require very prolonged immobilization, we decided just to go in and arthroscopically clean up your ankle, and most importantly, remove a bone spur that was preventing you from bending your ankle. And it's called Anterior Impingement Exostoses, and basically I went in and I shaved it and then I cleaned up your ankle with ankle arthroscopy. And well, tell me, was it a very painful operation?
No, it wasn't.
So
it wasn't. My recovery time seemed to went very well, and everything went along, and I wasn't in pain during the recovery process.
Well, it's interesting because I remember the first time I saw you after the surgery in my office, and you said, "Doc, that severe pain I had before the surgery, it's not there anymore."
Yes, it's not, and it never has returned.
Right. Well, because remember how you had that spur pinching the capsule of the joint, and once we remove that spur, that severe pain is gone. I mean, obviously, as I told you, you still have arthritis there, and we've injected it to help you. And I'm going to tell you that if you ever in a situation where you need a cortisone shot, come back, right? Because we can always help you if you're having a bad week. It's not a big deal. Just call me, come in, and we'll definitely use it as an alternative. But obviously, you don't need the shot today.
No.
So
the previous orthopedic, I think they are.
Yes.
I went to see. They treated me with cortisone for a year, and then told me they couldn't do anything for me.
Right. The thing is, cortisone is great, but when you have that anterior impingement bony exostosis, that bone spur, it pinches the capsule so much, and the only way to get rid of the bone spur is to go in and shave it. So with all the cortisone in the world, it's not going to unpinch itself, right? So, but basically, if we have to have it now, it's an option. Doesn't mean you ever have to use that, but the chances of it working now is much higher, right? So, and as I told you before when we first met, we definitely should try it because fusion is a permanent state, right? And it affects your knee, it affects your knee and hip. Obviously with you is right now you have range of motion, you're not in severe pain. So do you think it's worth trying this surgery before fusion?
Yes, I do. I would highly recommend it to anybody.
Good. So you're a big believer, right? Good.
Yes.
Well, you've been a very good patient. Very, very good, very compliant. So.
Well, thank you.